Good evening, everybody. We'll start with our session. Yesterday, because of some technical issues due to the heavy rains, uh, we have to leave the session. So we'll continue with the same remedy which we have started discussing yesterday. So we have to discuss the Ledum Pal. I have shared two cases yesterday, that my father's case where I have mentioned that in an acute state I was called by my mother at night around 10:15, and he was in an agony where he has already taken the combiflam tablet, he has taken the diclo injection, and still his pain was not settling, and he was absolutely in agony, and his right knee was fully swollen, big swelling was there, and along with that a left shoulder was also paining. It has started just after eating dahi vade at 8:30, and around 9:15 he started getting that swelling and pain, and then it shifted to upper extremity, but where it was not so strong. But in right knee, it was tremendous, and he was really ailing with the pain. And when I went over there, I saw that he was applying the ice cubes over there, and I asked, "Sir, Bhavu, why do you use the ice packs? Why not hot fermentation?" And he said, "Well, I feel better with the ice, and that's why I'm using." So remedy was very clear. Then two, three things are there. First important thing, it is an acute gouty spasm which has developed over there. Second important thing, that it has a typical modality that better by ice cold application. And third, it was going in ascending direction. Fourth, it was a cross rheumatism, right knee and left shoulder, like agaricus, it was there. So I have selected the Ledampal in 1 potency. I have given 3 doses and every 15 minutes. But after a second dose, his pain stopped. He slept, and he slept whole night without pain. In the morning when we woke up, he was absolutely normal. So this is the Ledampal. Ledampal is not an acute remedy. Ledampal covers the gouty rheumatism, and that's why its action is deeper. The miasm is more psychotic. If you open the Borix Matra Medica at the end, Gibson Miller's remedy relationship, you will find its action is 30 days. In injury remedies, this is one of the remedies which leads and which has a deeper penetration, and this is the remedy where you can get such types of futures. It is an injury remedy. Everyone knows it is an injury remedy. But uh, this injury remedy is a different, not only the injury, but there are many things which are there in Ledampal. So injuries which happens with the pinpoint needle, a stabbing injury, or injuries which happens because of awls. All those injuries comes under the sphere of Ledampal. The insect bites, a sting, it is again a pinpoint injury. All those comes under the sphere of Ledampal. It is very close to the apis. It looks like an apis, insect bites. But here the typical features which develops in apis, they are also there in Ledampal. There is an allergic reaction, there is a hives. I have prescribed this remedy for the hives. Hives means urticaria. A big urticaria is called as hives. It is an allergic reaction where the urticaria is bigger size, and that develops. That can lead even sometimes to the anaphylaxis also. That is covered with the help of this remedy. So it is a very important remedy in such cases. The second case which I have shared yesterday was that the eruptions, a young fellow came to me with lot of eruption, 30 years, 35 years, and whole forehead was with a tubercular or papular red colored spots were there, and they were stinging, they were itching. And he said it is since long time he is suffering from that. He has tried allopathic medicines without any results. And when I looked towards his eyes was little bit puffy, and I observed. I just put a question: whether do you take alcohol regularly? And he said he looked towards me like this, and How do you know? I said, your eye shows that. That's why I want to ask. So he said, yes, yes, doctor, I have a habit of taking 90 daily. Since how many days you are taking? Since long time. These are the these are the peoples where the brandy drinking causes a lot of trouble, and these are the eruptions which develops because of that. So that case I have treated with Ledampal lower potency, 30 potency, and it worked. Gradually, all those things disappeared from his forehead and it settled, and he covered very nicely with the help of that. So this was a wonderful experience with the Ledampal. I have treated many cases with where the sharp pains were there, sharp stinging injuries were there. I used to give first remedy. I used to give a Ledampal whenever it is pinpoint injury. So this is a wonderful remedy one should not forget. So let us listen and learn from the Allen's keynote so that you will not forget this remedy. We have started yesterday that Ledum Palustre, that marsh tree, where remedy from Ericaceae family. Adapted to dramatic gouty diathesis. The same sentence is there in colchicum. Yesterday we have discussed. And here the colchicum close, it's close remedy to it. But colchicum has its whole totality different. Colchicum autumnale, and there is an autumnal dysentery, there is a nausea, there is smell, nausea at the smell and sight of the food. The colchicum has a different symptomatology. So we can easily differentiate colchicum from the ledum. So ledum, the things are different. Here it has been written colchicum after the constitutions abused by alcohol. It is not there in colchicum. Colchicum has a vigorous constitution. They are strong. So there is a lot of difference between ledum pulp and colchicum. Only first sentence, yes, both remedies are gouty rheumatic remedies. So here alcohol plays very important role in constitutions of ledum pulp. Hemorrhage into the anterior chamber after iridectomy. And this is a wonderful remedy for the injury where extravagation of the blood happens inside the eyes. It is conjunctival hemorrhage you can get over there. Sometimes it is in the anterior chamber of the eyes where hemorrhage is there. So injuries are different types. Symptom, there is an corneal ulcer or it is an injury happens to the eye with the obtuse, the feast of the child who is feeding. That type of injury is covered with the symptom. But here injury is rather different. If there is a fibrosis which happens in on the cornea and which never heals and because of which that part becomes white, in such types of cases the silicia is the remedy. Boric has mentioned over there for the keratitis followed by a fibrous scar over there. If you want to remove that, use silicia 30 for months together. This is what the Boric says, and it is his clinical experience. I have tried it with one patient where there is a corneal opacity, and that corneal opacity cleared after say using silicia for 2-3 months consecutively. So these are the hints which you have to catch over there from the materia medica. Contusions of the eye and lids, especially if the much extravasation of blood, ecchymosis, especially of the lids and conjunctiva. So the blood inside the conjunctiva, blood inside the eyelids, very typical of this remedy. Then what he says, rheumatism or gout begins in lower limbs and ascends. Very important modality. Ascending rheumatism, ledum, first remedy. Descending rheumatism, kalmia, very important remedy. But kalmia has rather rheumatic aspect, where rheumatoid arthritis, autoimmune disorder that you can get over there in kalmia, and where the effect, it is a complication, post complication of the heart, rheumatic disease in the heart, which you can get with the kalmia in over there. Especially brought to a low asthenic condition by abuse of colchicum. See what is it? Especially if brought to the low asthenic condition by abuse of colchicum. So colchicum, which is used in material doses. There was a colchicum which was very well prescribed earlier for the gout in allopathy. But they used to use the material doses of colchicum, and that material dose used to produce its dangerous effects also. The patient used to get weakness, severe weakness. Asthenia is a weakness. Joints become the seat of nodosities and gout stones, which are painful. So it is the gouty nodosities which happens to be there. This is very typical with this colchicum as well as ledum pal. The typical nodosities around the joints, they are look like stones over there, are which are painful, acute and chronic arthritis. So this is acute gouty arthritis as well as chronic gouty arthritis. In both planes, the ledum works, and ledum has a very typical deep action also. So if you give ledum, there is no need to immediately complement, not needed immediately, because it itself has a deep action. So ledum you can use as an acute remedy in acute gouty attack, and you can continue and cover the disorder with the help of same remedy, or sometimes needed any antipsychotic remedy as a complementary. Affects left shoulder and right hip joint, agaricus, antimtart, stramonium. These are the remedies where cross rheumatism you can get. And this is very typical with this ledum pal also. Emaciation of the affected parts, graphitis, plumbum mate, another remedy. But in plumbum, it is because of paralysis which develops over there, and because of which muscle wasting happens to be there. Here, it is because of joint inflammation, patient is not able to move the lower extremity and weakness develops, emaciation develops. So in graphitis, in graphitis, a most important thing is that the obesity is uneven obesity. Some parts, lower extremities feels weak. Sometimes big, the thighs becomes very big. So variations are there. That is not proportional obesity which you can get in the graphitis. Pains are sticking, tearing, throbbing. See the character, sticking, something has been stuck over there, tearing, as if someone was tearing that. Throbbing, throbbing is like pulsating. Rheumatic pains are aggravated by motion, aggravated at night. Two modalities important, aggravated by motion like bryonia, aggravated at night, aggravated by the warmth of bed and bed covering like arnica montana. So warmth of bed aggravates. That is very typical with this remedy. Even though the patient is felt cold to touch, his body is absolutely cold to touch, and still patient feels aggravated because of the warmth of bed. This is absolutely different. There is one more remedy which is mentioned over there. It is aggravated at night and by warmth of bed and bed covering, mercurius, and amelioration only when holding feet in ice cold water like sickle cord. Sickle is also a chilly remedy but feels better by keeping things in ice cold water. See, here it comes closure. Complaints of people who are cold all the time. See, this is written in italics, and one must always, when you are in thinking about the letter, just check, touch the patient's body and find it out how much cold it is. Make a use of your back of the hand for checking the temperature. Just look over here, just look over extremities, and this gives you idea how what is the temperature, because in our materia medica these details are given, and these details sometimes confirms your prescription. For that purpose, it is a very important thing one should not forget. Complaints of people who are cold all the time, always feel cold and chilly, lack of animal or vital heat like sepia, like silicia, like soranum, most chilly remedy. But things are rather different. Even though they are chilly, they are aggravated by warmth. This is also another thing which you can get over there. The wounded parts especially are cold to touch. See the difference. Wounded parts feels cold to touch. That may be because of two reasons. Either it is original constitutional tendency toward coldness, or second, patient has a habit of using the ice cold packs over there, and that's why it becomes cold. But it is coldness is the characteristic of this remedy. Parts cold to touch, but not cold subjectively to the patient. So patient doesn't feel that he is cold internally. So this is too important. So one must make an habit of all those things. Always try to check. I used to check every patient. Clinical examination is must, and this has been taught by my teacher, Dr. Nitin Bhagli sir. You should examine each and every patient. And this is my habit. I used to keep this patient, my hand, back of the hand. I used to check the temperature because that gives you direct idea about the patient. In Sina also, you get the head is hot, extremities are cold. So you catch it. And that's the very important thing one should not forget. In some affections, warmth of bed intolerable on account of heat and burning of the limbs. So burning of the limbs, and patient doesn't want to keep it on it. They keep their extremities on cold surfaces. This is with sulfur. This is with lacasis. This is with medorinum. They feel their legs are severely burning and they feels hot and they wants to keep it on cold. Swelling. Now, how is the swelling? See how he explained. Swelling of feet, swelling up to the knees. See, this swelling is joint swelling as well as edema. This swelling is a joint swelling as well as edema, pitting edema. Both things are present in Ledum Palustre. Swelling of ankle with unbearable pain when walking, as from a sprain or a false step. So as the patient, whenever patient walks and he feels there is severe pain, he comes to you, doctor, I could not walk because of this pain, and it is very painful. And many times, one more thing that a patient explains, that they makes a false step. What is a false step? They get easily dislocated or sprained ankles. This is very important feature of Ledum Palustre. Then the carbon remedies, basically the natrum carb, you can get the same features. Carbo animalis, you get that easily spraining of the ankles. That is very important thing. As from sprain or false step, ball of great toe is swollen, painful, in the heels as if bruised. So these pains, swelling are there in the heels, these swellings are there in the ankles, in the ball of great toe. And many a times that ankle sprain happens to be there. Intense itching of feet and ankles. That is urticarial reaction. And these urticarial reaction, allergic reactions are common with the Ledum Palustre. They are common with the Apis mellifica. They are common with the rust tox. See, these are the remedies which one should not forget. These you can get very commonly over there. And these are the remedies which one must think whenever the allergic reaction you can get. So this is very important. Intense itching of feet and ankles aggravated by scratching and warmth of bed like pulsatilla and rust of. Easy spraining of ankles and feet. Here the carboanilis is mentioned. Natrum carb is also one of the important remedy. Easy dislocation of the feet, easy spraining of the ankles. Punctured wound by sharp pointed instruments. Underline. So if patient comes that he comes for the he has just punctured wound with nails, awls, or some sharp instruments, give one dose of ledum for two purposes. One, it prevents the pain. Second important, it prevents the tetanus. I like a hypericum. Hypericum is also good remedy for preventing tetanus. This is also one more remedy to prevent the tetanus. So ledum in just 200 dose, single dose, is very important in such types of punctured wounds. Punctured wounds by sharp pointed instruments as awls. Awls म्हणजे आरी. It is sharp pointed instrument. Nails, hypericum, rat bites, stings of insects. Here, rat bites, stings of insects, they are the sharp pointed injuries. So some many times there is immediate allergic reaction happens to be there. That also covered with the ledum. So ledum covers whole aspect of the case, and that is very important, wonderful. Rat bites, stings of insects, especially the mosquitoes, mosquito bites, things about the ledum. Red pimples or tuberculosis. There are many patients who comes to our OPD and they tells doctor, I don't know how I get, but I used to get more commonly the mosquito bites. Why I don't know. And whenever there is a mosquito bite, there is a lot of swelling happens. Give him a ledum. That is a very important remedy which one has to utilize. Then most important thing, red pimples, acne rosacea, or tubercles on the forehead and cheeks, as in brandy drinkers. Yes, this is very important. Brandy is little bit stronger alcoholic element mentioned by Murphy in his book. I don't know with which is stronger and which is weaker, but this has been mentioned by Robin Murphy over there. So these people suffers because of alcoholism, and basically the red pimples happens to be there on forehead. Stinging when touched. Stinging is very important. Stinging is we used to call it chunchunone. That is stinging. Long remaining discoloration after injuries. So long remaining discoloration are like arnica. But arnica, there is a blunt injury in ledum and hypericum, pinpoint injury with a redness of the parts. Black and blue places becomes green. So that afterwards turns towards the greenish hue. Ledum is one of the remedy. If it is purplish hue, lachesis is the remedy. So color is a wonderful thing one must not forget and one must think about it. Last point about the ledum pal, that relationship. And when we read the relationship, see the comparative remedy. What he says, compare arnica. Already we have discussed in length about the arnica. And we have compared the arnica injuries. Arnica injuries are very mechanical, blunt injuries where ecchymosis is there. And that to absorb that black eye, to absorb that black bleeding around the eye, arnica is wonderful remedy. Head injury, to stop the bleeding, arnica is an injury remedy. Croton tea is one more remedy which is useful in such types of cases along with the diarrhea. But croton tea has a very typical diarrhea feature, gastrointestinal features. Hamamelis having a vascular action. It is also one of the injury remedies that we're going to discuss later on, but it has more vascular action when on the veins. Belly spurs, belly spurinis is a remedy where long muscles or big muscles gets affected and rheumatism of them as well as injuries. One of the important remedies belly spurinis. Ruta, more commonly the cartilage damage, the cartilage affections, degeneration of the cartilages, injuries to the basically the sprains of the flexural aspects. Ruta is wonderful remedy. So in rheumatism, conime in long-lasting effects of the injury. This remedy generally we never take into consideration in injury, but it has been mentioned that if there are long-lasting effects of the injuries are there, one should not forget the conime. Conime is a remedy, geriatric remedy, old people remedy. Conime, it is slowly, gradually producing ascending paralysis is there. In conime, it is ascending paralysis. In ledum, it is ascending rheumatism. See, these are things one must understand. Conime is ascending paralysis, and that's why it is a very good remedy for Guillain-Barré syndrome. First sentence in Borix Mathematical defines the action of conime. But in conime, there is a hardness of the tissues. So we can differentiate remedy. Conaim is very deep acting psychotic remedy or psychosyphilitic remedy, which we can understand later. So this is what is Ledum Palustre. So we are going with this, and this is very important to understand. Yes, there was very good question by Kiran. Kiran, you asked how to differentiate urticaria of APs, thrust, and Ledum. APs urticaria is allergic reaction. APs is a thirstless personality. Generally, whenever urticaria happens, it is generally because of the insect stings, more commonly in case of Apis mellifica, but absolutely thirstless and hot patient is Apis. Rustox modalities are rather different. Both remedies having the similar erysipelatous condition. More in Apis, erysipelatous is marked. Rustox erysipelatous condition is marked. But Rustox, more commonly, it is not because of insect bites. Here, urticaria is because relation to the weather changes. More affected because of the typical cold, damp, rainy weather, the present weather, and associated with triangular red tip tongue. So features of every remedy, you don't have to take into consideration only the urticaria. You have to take into consideration rest of the features where the remedy you can differentiate. And ledum already just now we have discussed that ledum has urticaria because of insect bites, in sharp pointed instruments, or there is an hives. The urticaria is big. If you put the on Google hives and just see the images, you get the big articarial rashes over there. That is what is called as an hives. Which medicine used fever after cut injury by bottle glass, iron with swelling in rainy season to the farmers? You can use most common remedy is Rustox. First remedy I will think of Rustox because it has that depth and it has that acute pace also. So this is the remedy of this season. First remedy of choice is always Rustox. Then think of the rest of the remedies. Scorpion stings, will it work? Yes, definitely. Any sting, insect, it comes everywhere. So this comes very commonly, no problem regarding it. So we have discussed many aspects of this remedy. There is one more message. Scorpion stings, yes, you can use for this. And lastly, one more thing, one more question was there regarding the conjunctivitis. It depends upon symptomatology, what the patient presents. I know that epidemic of conjunctivitis is going on over there, everywhere. But you have to choose what the patient presents. It might be apraxia, it might be argentum nitricum, it might be simple belladonna also. It varies. You cannot define single remedy. What presentation? It might be pulsatile also. What presentation is there that you have to find? In Sangamner, I have not seen case. In fact, in my OPD, I have not seen single case. So I cannot explain. Nina Patil ji, I will explain Bellis perennis in recent. So we'll discuss the whole remedy. Bellis perennis is a very good remedy. We'll discuss Bellis perennis when we'll start the boric series. First, we'll finish the Allen's remedies and then we'll enter over there. Okay. So that's all for today. Very good night to everyone. There are many people who are joining, and ask your friends to join. This is a good for everyone, not for only for the student, but from practice point of view. These are the things which helps a lot. There is one Hardik has asked one question: which remedy you use for the old muscle sprain or tendon injury, and which potency? Hardik, it has been very specifically mentioned over there under the calcarea. If you open the Borix Mater Medica, chronic sprains and strains, it is the wonderful remedy. To remove that, yes, must use the calcarea carb as a one dose or two dose over there. Okay, old ligamental remedy, same remedy, calcarea, then calendula internally, the ruta, very, very important remedy. Sir Satyanarayan ji, do you want to ask something?
No, sir. No, sir.
Okay, so we'll finish today's session and we'll meet tomorrow again with the tomorrow is Saturday. No, not possible. We'll meet directly on Monday evening with the next remedy. And till that period, thank you everyone. Thanks a lot.
Thank you, sir.
Thank you,
Thank,
sir. Good night.
Good night.
thank you.
Bye.
Thanks.